Hi, good evening, everyone. Thank you for again taking your precious Sunday to attend our session today, where we are very grateful to have invited Dr. Yongmin Ju from Busan, South Korea. Today, his presentation will focus on the male and female pattern hair loss restoration by autologous stromal vascular fraction fat graft. Before that, let me just do a brief introduction of Dr. Ju. He is a medical director and CEO of Saron Clinic, a board certified emergency medical specialist, director, Ministry of Health and Welfare designated at once, Regenerative Medicine Institution, academic director of International Academy of Cosmetic Procedure and Stem Cell. Dr. Ju graduated from Busan National University College of Medicine, completed his residency in emergency medicine in Busan National University Hospital. Members of the following professional societies: Korean Society for Stem Cell and Tissue Regeneration, Korean Society for Stem Cell Research, Korean Society for Hair Restoration Surgery, Korean Society of Functional Medicine, and lastly is Korean Anti-Aging Medicine Society. So without waiting ado, may I pass the session to Dr. Ju? Dr. Ju, you can share your slide and introduce yourself and start the presentation anytime.
Yeah, thank you for introducing. Yeah. Good evening, everyone. I am Dr. Yongmin Ju. Today, I will be sharing our latest insights and clinical experiences on treating male and female pattern hair loss using autologous stromal vascular fraction and fat grafting techniques. Here's today's outline. We'll begin with the theoretical background on how SVF and fat work in hair regeneration. Then I'll walk you through the extraction and application methods. Finally, I'll represent real-world case studies using this technique in both male and female patients. Before we go any further, I'd like to clarify an important point. Today's presentation focuses specifically on androgenetic alopecia, that is, male and female pattern hair loss. We will not be discussing alopecia areata or autoimmune-related hair loss conditions. The therapeutic strategy I'm sharing today is based on adipose-derived regenerative treatments, particularly using stromal vascular fraction and fat grafting, which are most applicable to hormonally influenced progressive hair loss, not patch or inflammatory types. Let's begin with the biological rationale. Uh, We harvest adipose tissue and process it using two methods. ESVF, enzymatically isolated SVF using collagenase, MSVF, and microfat, mechanically processed using the adenizer device. The resulting cell mixture includes adipose-derived stem cells, endothelial progenitor cells, pericytes, regulatory T cells, macrophages, fibroblasts. This is not just a stem cell suspension. It's a heterogeneous mix, rich in ECM, cytokines, and growth factors. This diversity is what gives SVF its regenerative power. Uh, Pathophysiology of androgenetic alopecia, microenvironment. Androgenetic alopecia begins with disruption of the follicular niche. Several key factors contribute: reduced blood flow, blood supply, chronic perifollicular inflammation, ECM degradation, and increased androgen sensitivity. All of these, all of these factors create a hostile environment for follicular survival and regeneration. At the molecular level, molecular signaling, Wnt beta-catenin pathway is suppressed, blocking follicle stem cell activation. TGF-beta1 is upregulated, which inhibits hair growth and promotes fibrosis. VEGF is reduced, compromising follicular blood supply. Together, these processes accelerate follicular miniaturization and hair loss. Next, SVF role in hair loss restoration. Uh, how does SVF help? First, activation of the Wnt beta-catenin pathway, one of the most critical signaling pathways for hair follicle growth and regeneration. This leads to activation of bulge stem cells, then induces new hair follicle formation and hair regeneration. Next, angiogenesis through VEGF and HGF. Uh, EPCs and ADSCs in SVF secrete VEGF and HGF, promoting promoting scalp microcirculation, and enhanced blood flow supports follicular health and growth. HGF also cooperates with Wnt signaling to further stimulate hair follicle development. And IGF-1 and PDGF stimulate follicular cell proliferation. TGF-beta inhibition reduces fibrosis and hair follicle suppression. And M2 macrophages and regulatory T cells suppress inflammation, then stabilize the scalp environment. Now let's shift focus to the fat grafting synergy. Uh, Fat grafting can uh, refer sustained growth factor release platform. Fat retains viable ADSCs and pericytes. These cells continuously secrete VEGF, IGF-1, PDGF, and other growth factors, provide long-term stimulation of hair follicles, and supportive extracellular matrix scaffold. Fat tissue contains ECM, proteins such as collagen, fibronectin, and laminin. These stabilizes follicular microenvironment and anchors stem cells and restore follicular niche. Just like healthy soil is essential for roots to grow, ECM is the soil for hair follicle. Uh, and mechanical cushioning and restoration of tissue flexibility. Aging causes scalp fat layer thinning and rigidity. Fat grafting increases scalp thickness, then reduces pressure on follicles and improves scalp elasticity, enhances local blood flow. And fat tissue offers supportive microenvironment for stem cells. Co-injection with SVF can improve cell engraftment and survival. Stem cells from SVF are embedded in ECM-rich fat, then prolonged viability and function. Fat acts as a biological scaffold for therapeutic cells. An antifibrotic effect around hair follicles. Fat reduces chronic perifollicular fibrosis. This activates MMPs, matrix metalloproteinases, remodels stiffened tissue. In summary, SVF activation of the Wnt beta-catenin pathway, angiogenesis through VEGF and HGF, and IGF-1 and PDGF stimulation of hair follicle cell proliferation, inhibition of TGF-beta, anti-fibrotic and anti-alopecia effects, and anti-inflammatory effects. And fat plus fat graft, then sustained growth factor release. ECM scaffold provide mechanical cushioning and tissue flexibility, supportive microenvironment for stem cells, and anti-fibrotic effect around hair follicles. Now let's look at the clinical processes. We extract adipose tissue via liposuction and process it in two ways. Enzymatic digestion to isolate ESVF, and mechanical processing with the adenizer to obtain mechanical SVF and microfat. These can then be strategically injected into different scalp layers. SVF and nanofat are obtained by mechanically processing adipose tissue through an adenizer, which uses cutting edges of varying diameters to fragment the fat without enzymes. Here, I'd like to walk you through how we use ESVF and MSVF combined with fat, and more importantly, why we inject them at different depths in the scalp. We start with ESVF. This is enzymatically extracted SVF using collagenase to isolate a rich population of regenerative cells. These include ADSCs, EPCs, pericytes, and various immune modulators. Once prepared, we inject ESVF at the depth of the hair follicle bulb. That is right around the dermal-hypodermal junction. This is where stem cell signals can directly affect follicular regeneration, angiogenesis, and inflammation control. Now, let's talk about MSVF. This is mechanically processed SVF, no enzymes, usually obtained using an adenizer. It keeps more of the natural tissue structure intact, including ECM and stem cell niches. We mix this with microfat and inject it deeper into the subcutaneous fat layer. Why deeper? Because this layer plays a crucial role in supporting the hair follicle from below. It acts like a biological foundation. The microfat helps restores tissue volume and vascularity, while MSVF continues to release trophic factors over time, acting as a kind of a slow-release regenerative reservoir. Here's a short clip showing our protocol. ESVF, ESVF is injected near the hair follicle layer to activate the stem cells. This is dermal hypodermal junction. MSVF and MSVF combined with microfat is injected here into the subcutaneous fat layer, restoring volume and vascular support. This dual layer strategy optimizes both stem cell activity and the scalp microenvironment. Let's review some representative cases. When judging the outcome of the treatment, I check the exact location of the scalp with the semi-permanent tattoo and then check the trichoscope together. In addition, when taking pictures, a special photographing device is used to adjust the photographing angle and the brightness of the light. to the same condition. Let me share our first case. This is a 49-year-old male patient diagnosed with androgenetic alopecia. We treated him using a combination of enzymatic SVF and mechanical SVF with fat grafting and oral DHT blocker. After 16 weeks, clinically, we observed a notable improvement in both hair density and overall scalp coverage. In addition, trichoscopic evaluation revealed clear signs of regeneration, such as increased hair shaft thickness and reduced miniaturization. These findings reinforce that the effect is not just visual, but also structurally significant at the follicular level. This case highlights how dual-layer injections targeting both the follicular zone and subcutaneous fat layer can lead to meaningful outcomes in a relatively short time. Our second case is a 34-year-old female diagnosed with female pattern hair loss. She underwent treatment with ESVF and MSVF combined with fat grafting and minoxidil local solution. After, after 12 weeks, we observed an increase in terminal to vellus hair ratio and wider hair shaft diameter. These objective findings suggest that beyond cosmetic change, the follicular architecture was genuinely restored. Here's another case, a 34-year-old female patient also presenting with female pattern hair loss. We applied the same protocol as the previous case, ESVF combined with MSVF and fat grafting and local minoxidil solution. After a 12-week period, the results were remarkably consistent. She demonstrated increased density in crown regions. Trichoscopic images again confirm thicker hair shaft, reduced miniaturization. Our final case is a 55-year-old male with advanced androgenetic alopecia. He received only ESVF injection. After 20 weeks, uh, After 20 weeks, his trichoscopic findings showed regrowth of previously miniaturized hairs, increased hair density. This can illustrate that even in older patients with advanced AGA, regenerative approach can produce meaningful structural recovery and visible clinical benefit. This case is a case in which ESVF alone was performed without DHT inhibitors. DHT inhibitors are still playing a key role in the treatment of male pattern hair loss. And I think it is a case where we can expect a stronger effect of MSVF plus fat graft than ESVF alone. In summary, this SVF plus fat grafting protocol offers a long-acting biologically integrative solution to hair loss. When combined with DHT blockers, outcomes are even better. Unlike weekly injection protocols, this method provides lasting effects via stem cell activation, angiogenesis, ECM remodeling. It's a convenient alternative to conventional hair loss treatment. Thank you for your attention. I welcome your questions and look forward to discussing how this technique can fit into your own clinical practice.
Thank you, Dr. Ju, for the presentation. And right now, we will open up the floor for any questions. Um, you guys can raise your hand if you want to speak up, or you can put into the chat. and we will read up the questions. Okay. You guys can ask question right now. There's one question from a good friend, Dr. Kusuma Vidyawati from Jakarta, Indonesia. The question here is that while putting stromal vascular fraction with microfat to the subcutaneous layer of scalp, do you experience of some harder pressure since those places very tight? You want me to repeat back the question, Dr. Ju?
예.
Okay. I think the question here is that while you are injecting the stromal vascular fraction with microfat to the subcutaneous layer of scalp, do you
예.
experience of pressure since those places are very tight? Pressure, I think.
예. When I inject fat into the subcutaneous layer, I used the 21 or 23 gauge cannula. Before injection, use my cannula dissection the structure. After dissection the structure and uh, uh, 공간을 확보하다. And make some spaces and then I injected. So the high pressure was not a big problem for me.
석유 쪽에 그 다이섹션을 먼저 하고서 하는 건가요?
예, 예,
그러니까 21게이지나 23게이지로 다이섹션을 먼저 하고요.
맞습니다. 예.
Dr. just said
주사로
is yeah, because the sub-Q areas there is some pressure issue. He using the 21 and 23 gauge needles for dissection the structure first and then inject the microfat and SVF. So in this way, he has no issue for the pressures.
Thank you, Jung. Thank you, Mr. Peter, for yeah, clarification.
Sorry
Are
for
there
my
any questions
poor
from the
English.
floor?
Yes. Do you ever combine this with highly dense PRP?
전에 PRP랑 같이 쓰신 적 있으시나요?
Another case, 아, 오늘 소개된 케이스 말고 다른 케이스에서는 PRP를 자주 사용하기도 하는데 오늘은
음.
그냥 오늘 명시한 그것만 썼습니다.
Actually, the Dr. Chu has many experience for the using the PRP for the hair degenerations, but today's session is mostly focused for ESPF, MSPF. But he has so many experience for the with the PRP
No,
for
the
the hair
question.
degeneration.
Sorry, the question was different, which is, do you combine it? No, I appreciate that
오케이.
you're wondering if they
PRP랑
combine it.
같이 콤바인 하신 적이 있나요? 원장님,
주로 예,
PRP랑 같이.
컴바인은 자주 합니다. 제가.
Yeah, he's still using the combining with the PRP and microfat and enzymatic SPF together.
Okay, so he sees that as an improved way of delivering more, or is it somehow synergistic in other ways?
뭐 시너지하게 효과가 있거나 PRP랑 하면 그런 게 좀 있으신가요?
확실히 지금 완전히 제한된 조건으로 PRP 사용한 거 안 한 거까지는 못 해봤는데 확실히
네.
PRP를 같이 했을 때 조금 더 뭐 시너지가 나는 것을 경험 많이 했습니다.
He has experience from combining use of PRP and fat, ESPF. He feels a little bit synergic result he has.
Okay.
Okay, I think we have one question from also one of our speaker, a dear friend, Dr. Chris Kim. The question here is that how much cc do we inject into scalp at one time?
어, ESVF 아, 제가 피터님 바로 말씀드릴게요.
네네.
그, 아까 ESVF를 이제 얕은 층에
네네.
페리폴리큘러 레벨로 할 때는 대략 토탈 볼륨이 한 5cc, 5cc 전후로 스칼프
네.
전체 커버를 하고
음,
어, 팻을 이제 더 깊이 주입하는 것은 한 1, 2, 3, 4, 한 8에서 10 정도.
어.
예.
Dr. Ju, do you usually they inject follicular scalp areas using the enzymatic sphere? Using injectable 5 ml, 5 cc. But for the subcu areas, the injection with microfat, he using the 8 to 10 cc.
Yeah, with that, right? Maybe I have a question for Dr. Ju. Normally for your harvesting fat, in order to get the 5 cc and also for the 8 to 10 cc of the nano fat, usually how much do you harvest the fat from the abdominal for your procedure?
그 엔자메릭 이거 할 때 8cc, 10cc 정도면 어, 보통 지금 한 30cc 하베스트 하신가요?
순수 지방.
네.
그래도 한 40에서
예.
60 사이 정도 순수 지방으로.
He usually harvesting 40 to 60 cc pure fat. Yeah.
So then, I believe that because I do have some experience with enzymatic and mechanical, which means you will apportion some for the enzymatic processing, and you will apportion some of the fat for the mechanical processing, right?
Because when we using the adeninizer sizing down all the way, then we speeding high speed like 1200 the RCF for 5 minutes. But it's up to, but actually the fluid SVF at 3 cc something. And then I think the some ECM layer and 3 to 4 cc. So in this way, I think the 40 cc or 60 cc is just so many good enough for the covering the for one full face. Well, but I missed the here. Yeah.
Okay. Thank you, Mr. Jung. Okay, we have one question from Sinang Strength. Dr. Ju, how often do we need to inject ESVF plus MSVF grafting? And in case combined with HDD or minoxidil solution, do we start at the same time? I think the
근데
first
이게
question is how often do you inject
예,
the enzymatic and mechanical SVF for grafting? Yeah.
몇 번 정도
안,
인젝하시? just
안드로겐 탈모 초기 정도로 봤을 때는 어, 그냥 한 번 정도 시술로 하고 평상시에 시술 이후에 본인이 먹는 약이나 관리에 따라서 뭐
음,
몇 년 간격으로 이제 진행 정도를 두고 판단을 할 수 있겠고,
음,
아까 제가 케이스 1번으로 소개했던 저분 같은 경우에는 워낙 좀 진행이 많이 된 저런 케이스 같은 경우에는 할 수 있으면 뭐 이제 SVF 시술을 뭐 자주 할 수 있으면 좋지만 그게 현실적으로 좀 힘들 수 있기 때문에
네.
뒤에 한 3개월에서 6개월 간격으로 PRP 시술이라든지 다른 재생의학 시술을 좀 병행해 주는 게 좋을 것 같습니다.
Actually, the initial stage of the androgenetic alopecia, he's going to using the just one time is good enough with but he's recommending the oral the tablet of the minoxidil or something. And then for the first patient, like 55, the male patient in that case is the after trying the first this mechanical SPF and microfat, then he's going to be recommending 3 to 6 months the using the PLP and follow up. That's the his recommendation.
Okay, getting more interesting. We have more questions coming in.
Mm.
Another question is that how long does the result last after treatment, and for
Mhm.
how long intervals patient need to repeat the treatment?
For the lipid payment, I think already he's talked
Yeah,
about that,
six
but I
months.
think the 얼마 정도 이게 결과가 지속이 되는 거로 예상.
아까 말씀대로 이제 상당히 좀 아까 2번, 3번 케이스 같은 진행이
네.
얼마 안 되신 분들 같은 경우에는 1회 시술하고 본인이 좀 관리하기에 따라서 몇
네.
년까지도 이제 예상을 할 수 있는 거고 조금
네.
진행이 많이 되신 분들은 최소 1년에 한두 번은 좀 체크를 해가면서
네.
경과를 봐야 되지 않겠나. 왜냐하면 이식된 지방도 결국은
네. 네.
2, 3년 이상씩 지속 유지가 되기는 좀 힘들기 때문에 트리코스코피나 팔로우를 통해서 계속 좀 확인을 해야 될 것 같습니다.
네. Like the patients second number two and three, like initial stage patient, the one times of the injection of stem cell is good enough, but the other patient like the first patient and more the serious stage of the patient per year one or two sessions by the observation and sometimes the trichoscopy, and then he's going to be follow up with PRP and second thing. So I think the initial stage of the patient has the one injection is good enough, long lasting. But for the serious patients, like first patient, in the case is the he's going to be recommending to 1 to 2 times on the way he's checking with the trichoscopy, and then just in case he follow up with PRP or something.
Okay, I think that answer also I have answered Dr. Chris Kim second question.
Mm.
Okay. And yep, we have another question from Xiaomi M. It's a mobile. Okay. Hi, Dr. Ju. Like we inject nanofat intradermally on face for facial rejuvenation. Do we
Mm.
inject nanofat intradermally on scalp in combination with microfat injection subcutaneously?
저는 사실 팻은 사실 인트라더멀 인젝션을 별로 안 해봤고 팻은
네.
저는 서브큐 쪽 그다음에 그 셀 성분 SVF 성분만 이제 인트라더멀을 주로
어,
이용을 하는 편입니다. 예.
because already the Dr. Ju talked about during the presentation for intradermal, mostly using the enzymatic aspect, but the sub-Q areas he's going to using the fat because it's giving the scaffolding and ECM microenvironment for the that areas. So that is his experience.
Okay. Another question from Kawe Alizada. Do we need enzymatic digestion since we can use adenizer to get SVF at 400 microns to provide cellular components?
It means the combining with the enzymatic SPF, mechanical SPF using the 400 micron.
No, I think the question here is do we still need enzymatic digestion since
Mm-hmm.
adenizer can
Mm-hmm.
provide SVF
Yeah, yeah, yeah,
400
you're right.
microns. Yeah.
그러니까
이제
예,
이미 우리가 엔자이머리 미케니컬이 SBF가 있는데 엔자이머를 또
예.
다시 추가할 필요가 있는지. 네네.
셀 컴포넌트는 그 인트라더멀 인젝션
네네네.
위치에는
아,
셀 컴포넌트에 더 포커싱을 하기 위해서 예.
네네. 아, I see. So
사실
actually
이게 좀 되게 번거롭고 비용도 많이 드는
예,
작업인데
맞습니다.
제가 생각할 때 이게 더 효과가 있을 거라 생각했습니다.
네네. Because the his concept is like intradermal, he prefer to using the enzymatic and SBF, but for sub Q at that areas the mechanical SBF and microfat. That is his preference. But when you're using the enzymatic way, as you everybody knows about that, it's a little bit costly because it has enzymatic processing time. But in his protocols, the the intradermal, he preferred using the enzymatic way, and then sub-Q areas, he's going to prefer mechanical way. So even though it's a little bit costly, he is using both.
But I guess I was wondering what is the advantage of that, given the fact that you have access to the same cellular component? What's the advantage?
Oh,
Maybe can you repeat the question again, Kaveh?
Yeah, the question is, since you're able to get a cellular SVF
hmm.
using mechanical approach, why go through the extra steps of the enzymatic digestion since you're able to get this cellular component when you get down to 400 microns, right? You can get nanocells with the adenizer. So why go through that extra expense and time with enzymatic digestion when you have this available? That's the question.
아까도 이제 언급을 잠깐 드렸지만 그
네,
엔자임을 통한 SVF가 셀 컴포넌트 자체는 더
네,
높은 회수를 가져올
네,
수 있기
맞죠.
때문에 그다음에 미케니컬 SVF는 저는 이제 팻을 약간 그 아까 따로 언급은 하지 않았는데
네네.
팻을 약간 녹이는데 사용을 하는 쪽에 포커싱을 했고 이제 셀
네.
컴포넌트를 더 얻기 위해서 엔자임 다이제션까지 같이 했습니다.
Actually, I have the long experience for the agenizer, but from my experience for the mechanical way we using the agenizer, unlike the enzymatic way, totally and clearly not separate the SPF because the some SPF is located in the bottom area, some is located in ECM layer just above the fluid layer, and then some adipose layer is unlike the enzymatic way not clearly separated. So that's the reasons why he's going to more cellular SPF using the enzymatic way uh, the, to enhancing the result.
Thank you.
Okay.
I have one question, Dr. Ju. Since with enzymatic S SVF, I think a lot of procedure they do IV. Does IV intravenous injection with ESVF applicable in hair restoration, in your opinion? Or you just need a direct injection?
어떠세요, 원장님? 쪽에 아이디로 해서 넣었을 때 헤어 쪽에 시너지한 결과가 있다고 보시는지?
그 환자들이 이제 탈모를 목적으로 왔을 때는 사실은
네네.
IV를 통해서 이제 딱 이렇게 효과가 있다라고 말씀드릴 수는 없는데
네.
다른 목적으로 항노화 목적으로 주로 많이 하니까 다른 목적으로 IV 맞으신 분들이 뭐 모발이 풍성해졌다는 케이스들을 제법 저희가 겪었습니다. IV로
아,
했을 때도 특히 어르신들 같은 경우에
어,
그런데 이제 그걸 가지고 뭐 탈모 치료 목적을 위해서 IV 하는 것까지는 아직 좀 연결고리가 너무 약한 것 같아서 저는 그렇게까지 해본 적은 없습니다.
Uh, actually, he hasn't experienced for that cases like this one simultaneously with IV injection with the hair. But actually, some of the old patients is IV injection is mostly using the anti-aging purpose. But from their experience, they feel better. But Dr. Ju doesn't recommend that one. Yeah.
Okay, thank you. Very happy to see many questions coming in. We have
Mm,
one question from Jackie. I think first question is how many injection? I think that has been answered numerous times.
mm,
The next question is that do we need to harvest fat every time for SVF? Every time when you need the SVF, do you
mm.
need to harvest each time, or do you store the fat or for digestion in the future?
Let me respond for that because I have so many expenses for the fat. I think normally every time the harvesting is good, but we cannot do every time. So I think we can, in shortly, from my experience for the harvesting, it's not minus 40, minus 170, minus 196. We don't need special refrigerator, but normally the 14 and 20 Celsius degree. In the cases, I think the 6 months is good because after, but when we the processing the adenines again 6 months stored in minus 12 and normal refrigerators and 20. In the case we after take it sewing that one, we spin that one, we see a lot of oils. So after leaving the oil, we can using that bioscaffold stem cell still when I count digesting that one and counting, there's just a lot SPF there. So I think not every time, but for 6 months, up to 6 months, normal temperature is still okay, I think, if that is kept in sterile. But whenever using the that one, thawing and spinning at a certain sexual degree, at the spinning speed, then we can remove the oil, then adenizing again, and we can make it that one second use, I think.
You mean you can store the fat for
Yeah, no,
later
normal.
months injection?
Yeah, yeah, right. So every time that we can, so the fresh fat is better, but every time we cannot that one. It's just short term, like up to 6 months. I think we can store fat, not SPF, store in a normal refrigerator, so in minus 14 to 20. Then we can spin and remove the oil. Then we can adenine and we can using it again.
Okay, I think that also answer Jackie. The following question, I think is his question here is that each time injection 12 to 20 weeks, how many times for injection? I think you have answered the question because if you can really store the fat for future isolation, then I think that is unlimited session, I guess. Yeah.
아까 이제 제가 케이스 공유드린 케이스들은 1회씩 이제 시술을 한 거고, 어, 근데 시술 자체를 이제 저장을 하지 못한다는 가정하에서는 매번 결국 뽑아야 되는데,
그렇죠.
최소 한 6개월 이상 간격을 두고 이제 초음파 확인을 해서 그렇게
네.
하고, SVF 말고 PRP로 시술하는 경우에는 사실 매주 이제 또 다른 모낭 주사까지 같이 병행을 해야 되고, 뭐 그런
네, 네.
식으로 하고 있습니다.
The today's case for patients is mostly the single cases with enzymatic and mechanical SPF, but normally he's taking and then sometimes he's follow up with PL. But yeah, so I think that's his experience.
아, 그리고
Or you
아까
mean
그,
that Dr.
Yeah,
Ju follow up the session with PRP instead of SVF?
PRP only. Yeah, yeah. But just in case it's the 6 months, the harvesting another fat, and then he tried again.
Okay, got it.
그리고 아까 그 시술 피리어드라고 제가 표현을 해서 아마 조금 오해를 하셨을 수도 있는데, 그냥
네네.
1회 시술하고 경과를 본 기간을 아까 다 명시를 한 겁니다. 매주 어떻게 몇 번
어,
시술을 한 게 아니고, 혹시나 그것 때문에
어,
헷갈려서 물어봤을 수 있을 것 같아서.
예. The 6주 후에 경과를 본다는 거죠. 그러면 처음에 인적하시고.
16주, 20주 적혀 있던데 다.
원래 예, 통상 한 3개월 정도 기간을 두고 제가 체크를 하려고 했는데
네네.
방문자가 이제 방문하지 못하는 상황이 돼서 20주가 된 분들도 있고 뭐 12주에 딱 맞게 오신 분들도 있고 그게 조금 아까 달랐습니다.
그러면은 12주면 한 3개월이네.
통상 한 3개월 간격으로 경과를 보죠.
어,
효과
야,
판정.
normal, no, after first injection, he's checking in every 3 months, like yeah, 12 weeks.
Okay. I think for the following question from Dr. Jackie, already answered by Dr. Ju. Yeah. Okay. Are there any more questions from the floor? before we close the session? Any more? Do we have one more last question for Dr. Ju? Okay, Dave, there's no more questions. Thank you very much, Dr. Ju, and thank you very much, Mr. Peter Jung. Sorry, I think there's one more question, I guess. Give me a second. Yeah, I think Jackie again. Can we combine? Are you meaning, Dr. Jackie, are you meaning to combine ESVF and MSVF with PRP? Is that what you mean? So anyway, we are also want to announce that is the upcoming hands-on live workshop where you can see Dr. Ju doing a workshop, hands-on workshop in Bangkok, which is scheduled on the 11th to 13th of July 2025, where Dr. Ju will focus on his hair restoration, fat harvesting, and how he processed the fat, enzymatic and mechanical way, and also how he do the injection. Okay. Um, yep. I think the last question is come from Jackie again. Can we combine SVF and PRP to have better result? I think again that has already explained by Dr. Ju that he inject PRP as a post procedure after the SVF 13 to 20 weeks, I guess. That's how you have answered. All right. So, all right. And last question again, Jackie, SVF can be stored in which degree? I think it's not SVF, right, Peter? It's talking about the fat, right?
Yeah, yeah, we can store, but it's a very we need a special temperature rate or it's -169 because the stem cell normally in room temperature start dying 2 hours to 72 hours. All the stem cells die. So I think even though they kept maybe 3 days something in normal 0 to 9 Celsius degrees, okay. But I recommending don't store there rather than storing in the normal clinical operation room. They have just a room, single simple refrigerator. I don't recommend storing the SPF. Then rather than we do better storing fatty cell and then sewing and centrifugation and living oil, and from there we processing again. I think we do. It doesn't make good sense to store the SPF in a normal whatever is the refrigerators.
Mm. So which means it's storing the adipose tissue, it's not storing the SVF.
Yeah, right, right. If they
Thank
have
you,
the
Dr. Ju.
-169 special, the cryo style, the special refrigerators, it is very professional one. Otherwise, we don't recommend them.
Okay. Okay, I think thank you very much, Dr. Ju. Thank you very much, Jung. And I think for our next upcoming webinar will be by Dr. Chris Kim. That will be on the 29th of June, where he is focused on facial using the ESVF and MSVF. So with that, once again, thank you very much for the very active participations with all your questions. I think that shows us a lot of interest in this hair session presented by Dr. Ju. Okay, so again, thank you very much and good night uh, for participation for this webinar. Thank you very much, guys. Good night.
Thank
Thank
you.
you very
Good
much.
night.
Thank you, Dr. Ju. Thank you, Peter.
Thank
Thank you,
you.
Jackie. Yep.